cerebral palsy, which is also known as CP. So what is it? Cerebral palsy is a group of neurological disorders that appears in infancy or early childhood and permanently affects body movement and muscle coordination. The cause is due to damage or injury to the brain that happens most commonly while in the womb, but could also happen during birth or soon after. The severity and symptoms vary for children with CP. Cerebral palsy is not progressive, which means it doesn't get worse and generally stays the same over time. There are 4 main types of cerebral palsy, and they are spastic, dyskinetic, ataxic, and mixed types. So for spastic, that is the most common, with 70 to 80% of people with cerebral palsy. They all have that. And that means that they have stiff muscles and awkward movements. Then we have dyskinetic. It's not as common. However, it means that when you move your hands, your feet, your arms, or your legs, it's slow, uncontrollable, and or jerky. For ataxic, it's also not as common. However, people with cerebral palsy that do have it, it affects their balance and their depth perception. So children with this specific type of cerebral palsy often walk unsteadily with a wide-based gait, which means that their feet are further apart than normal. And mixed types means that their symptoms represent all different types of the 3 that I just listed above. They're not tied down to one specific type. They're just a big mix. So children with CP experience a variety of symptoms, some of which are a lack of muscle coordination when performing voluntary movements, stiff or tight muscles and exaggerated reflexes, weakness in one or more arm or leg, walking on your toes, a crouched gait, which just means a crouched, like your stance, kind of crouched, or a scissored gait, shaking tremor, or random involuntary movements. People with CP also have a difficulty with small movements, small and precise, like writing with a pencil or buttoning a shirt, something that requires a lot of precise movement. So there are some conditions that often co-occur with cerebral palsy. Up to 50% of people with CP also experience intellectual impairments, which can include poor memory and concentration, developmental delays, avoiding social interaction, and difficulties with logical thinking and problem solving. Hearing impairments affect roughly 12% of people with CP, and it can include incoherent responses, so responses that you necessarily don't understand, confusion when they're spoken to, delayed or no reactions to loud and sudden sounds is also something it can include. People with CP often experience vision impairments. The most common ones are people are cross-eyed or nearsighted or farsighted, and cortical visual impairment, which that means it's the brain struggles to process visual information. So that can cause you not to be able to recognize familiar faces or different places, or just like posters on the wall. You're not really able to process that. Roughly 75% of people with CP experience chronic pain because of the increased muscle tone, the spastic muscles, and the muscle tightness. Children with CP are at an increased risk for behavioral problems because of the challenges that the disability presents. One of which is difficulty communicating. That is the most common one that leads to behavioral issues, because they want to be able to communicate effectively, but they just sometimes can't, and that's very frustrating. Children with CP commonly experience epilepsy because CP is caused by a brain injury, And brain injuries increase the chance of abnormal nerve activity to occur, which can then result in seizures. Okay, so let's talk about you. What is your role as a teacher? Your role as a teacher is to have frequent communication with the student's parents. The parents offer insight on different strategies that work best for them at home, their child's strengths and weaknesses that they've noticed, and any triggers that they might have. Teachers should also have regular check-ins with students with CP to discuss any modifications you need to make, ask how they want to approach different activities, and see how they are doing in general. Educators should also be prepared for any medical emergencies. So again, students with CP are more likely to have seizures, so teachers need to know what to do in that situation. Children with CP may need to take medicine in the nurse's office, go to the doctor, things like that. So teachers should have a plan for when that does happen so they can make it up. Teachers must adjust the seating arrangements if needed, because if a student with CP has vision problems or hearing problems, you can set them closer to the front of the class so that they can see or hear better. It's also your role as a teacher to make your classroom accessible to all students. Some children with CP are in a wheelchair, so making sure that there is room for them to move around the classroom is very important. And children succeed when they feel valued, safe, and loved. So it is your job as a teacher to make all of your students feel this way. Accommodations. Children with CP may need some accommodations. They may need extra time on assignments, may need extra time to process, to get places around the school. And some children with CP have adaptive tools. So those are like walkers, wheelchairs, crutches, braces, that type of thing. So it is important to keep the classroom clean and clutter-free so that everyone can get around. The format on tasks and assignments may need to be adjusted so that all students can participate, such as taking a written test verbally, since it is really hard for them to do small movements like writing, or having their classroom aide fill in the bubble, because that is such a small and precise movement that it might be hard for them to actually fill in the bubble. So alternative communication can be used, such as iPads with pictures and words. If student with CP struggles with speech, so that is an option. A communication board is also an option. There are many options for alternative communication. Children with CP may also benefit from having an aide in the classroom to help with communication, physical assistance, and academic support. So children with CP may require different services. So speech and language therapy can help improve a child's ability to speak, to swallow, and to communicate. And by communicate, it is a little bit different than speaking, because that can include sign language or communication devices, the communication board, the iPad with the words and the pictures. So that's a little bit different. Occupational therapy, which can help children with CP to improve their posture, their upper body function, and their mobility. And this also helps children address new ways to do everyday activities. So doing just simple things like brushing your teeth. Like first you have to get out of bed. That's something that they have to work on because their mobility is kind of weak, but by working with occupational therapists, they can actually improve that. Physical therapy is very important for children with CP, especially during their first few years of life. That's really a cornerstone for children with CP. This helps them improve and maintain muscle strength, balance, and their motor skills. A classroom aide can help them get around, do small movements such as taking a test, holding a pencil, and also helps them academically. So there's not just one service that's better than the other. They all play a big factor in their overall quality of life. And here are my citations. Thank you.